In 2021, the FDA authorized the first prescription virtual reality headset for chronic pain. Not for entertainment, not as a distraction technique, as a therapeutic device with the same regulatory pathway as a medical implant. The product is called RelieVRx. Now, in the pivotal clinical trial, it was called EaseVRx. I mentioned both names because you'll see them used interchangeably. I'm Dr. Trevor Turner from Pravida Health, and today we'll walk through the evidence. The clinical target is chronic low back pain in adults. Not acute pain, not radiculopathy with red flags, not undifferentiated back pain that hasn't been worked up yet. Specifically, chronic low back pain that has persisted for months to years, where central sensitization, the nervous system's amplification of pain signals, is a meaningful component. This is where the nervous system amplifies pain signals beyond the initial injury site. Here's how the protocol works. 8 weeks, roughly 6 minutes of VR per session, daily use. Total commitment is under an hour per week, and the treatment combines immersive VR with cognitive behavioral therapy. It integrates mindfulness, biofeedback with your own breathing, and pain reprocessing skills delivered through the experience. Now let's talk evidence, and I want to be precise here because this is one of the most interesting evidence communication questions in digital therapeutics. The pivotal trial was Garcia and colleagues, published in JMIR in 2021, 188 patients, randomized to RelieVRx versus a sham VR control. The within-arm pre to post reduction in pain intensity was about 1.17 to 1.30 points on a 10-point scale. Meaningful, but not enormous. This study established the baseline for FDA authorization. The between group Cohen's, the effect size versus the sham arm, was 0.40 to 0.49. That's a small to moderate effect over an active control. Then, in 2023, Maddox and colleagues at Mayo Clinic Proceedings Digital Health published a real-world observational study. 1,067 users. Pain intensity dropped by 2.0 points. Pain interference, the degree to which pain interferes with daily activities, dropped by 2.3 points. This larger real-world cohort confirmed the findings of the earlier randomized trials. Here's where clinical honesty matters. A 2-point drop from baseline is not the same claim as a 2-point drop compared to placebo. The randomized trial showed about 0.4 points of benefit above the active sham. Both numbers are true, they just answer different questions. The 2-point number is what a patient expects. The 0.4-point number is what's specifically attributable to the device. The durability data is genuinely encouraging. A follow-up study published in Pain Medicine showed the improvements were maintained at 24 months. That's remarkable for any chronic pain intervention. Most interventions we use have benefits that fade within months. And the mechanistic evidence is getting stronger. A 2024 trial by Ashar and colleagues using MRI showed measurable connectivity changes. The study showed changes in the brain following pain reprocessing therapy delivered through VR. So where does this fit in a Pravida practice? I think of it as a 4th tier of chronic pain care. Tier 1 is diagnostic, Tier 2 is regenerative, Tier 3 is rehab, and Tier 4 is VR targeting central sensitization. What VR is not. It is not a diagnostic tool. It is not a substitute for imaging when someone has red flags like neurologic deficits or unexplained weight loss. Red flags require a full diagnostic evaluation before proceeding to immersive therapy. If you have chronic low back pain and you've addressed mechanical drivers, RelieVRx is a legitimate, evidence-based, non-opioid option to consider. If you'd like to explore whether this is right for you, the consultation link is in the description. And to see how we approach the mechanical side, my video on regenerative alternatives to spinal fusion is a natural next step. Subscribe for more. Thanks for watching. I'm Dr. Trevor Turner.